joined now by our In Focus Health correspondent, Linord Moudou, and you have some good news from Sudan.
Yes, indeed. Children's Hospital getting more help.
Tell us about it.
Definitely good news. The United Nations mission in Sudan has handed over a new 6-room outpatient building for the Al-Sabah Juba Children's Hospital. The project was initiated by the UN's Public Information Office in Juba, commemorating the International Day of UN Peacekeepers on May 29th. Soldiers from Bangladesh built the brick structure, completing the work in 3 months at a cost of $25,000. In the past, children seeking treatment at the hospital had been forced to wait in a courtyard on the hospital premises. Winnie Babi Huga is the head of Sector 1 at the UN mission.
We were here to celebrate the Peacekeepers Day for this year on the 29th of May. And the theme for that day was Power to Empower. And I believe all of us can now see the kind of empowerment that this structure will create, and also what has come out of a partnership.
And next we go to Nigeria, where efforts are underway to encourage mothers to breastfeed their newborn babies. Jacqueline Mesarahan has a story.
Doctors say a major step towards a child's healthy growth starts with a mother's first breast milk, known as colostrum. It helps to build the newborn's immune system.
Colostrum has a lot of antibodies and with some protein too. So it's important in the sense that it helps to protect the child from the sudden exposure to the world.
Dr. Vince Emeribe warns that this does not apply to mothers living with HIV and AIDS. He says they are advised not to breastfeed their babies because an infected mother can transmit the virus to her child. But he says healthy mothers should breastfeed their babies for at least 6 months.
The first 6 months with breast milk, the children have equal access to nutrition and equal access to immunity. You cannot differentiate the child of a beggar from that of the president.
Nutritionist Iwalola Akinjima says after 6 months of breastfeeding, a baby can be introduced gradually to solid foods such as porridge enriched with blended groundnut, ground meat, mashed beans, fish powder, and a mix of vegetables and fruits. She praised the Nigerian government's plan to ensure that children have an adequate intake of vitamins.
The good thing that the government has done now is to include vitamin A as part of the processes of immunization. So you find children being given vitamin A so that in case they're not getting enough from their diet, from their meals, at least that will serve as a booster.
Doctors say that children also need an adequate amount of carbohydrates in their diets for energy and enough protein for normal growth. Poor children often suffer health issues because they simply don't eat enough balanced meals. Doctors say many children who are hospitalized suffer ailments traceable to lack of protein. Again, Vince Emeribe.
When the breadwinner, like the husband, is no more working and the woman is a petty trader, protein may be difficult because you need animal protein basically, where you need to eat meat and eggs, fish, and all that. So you need good money to be able to buy these things.
Nutritionists explain that vitamin A found in vegetables and fruits can prevent partial or total blindness. Vitamin C, commonly found in fruits, prevents bleeding gums and ensures quick healing of wounds. And iodine, commonly found in seafoods, aids proper development of the nervous system. It also helps a child's intelligence quotient and prevents goiter, an abnormal swelling of the neck. From Lagos, Nigeria, Jacqueline Mesarawan reporting for VOA.
Finally, the Bill and Melinda Gates Foundation is funding a new project to analyze the effect of aflatoxin on crops in Kenya and Mali. Aflatoxin is a toxic carcinogenic byproduct of fungi that contaminates maize and groundnuts. Voice of America's Kimberly Russell has more.
The Centers for Disease Control and Prevention estimates that 4.5 billion people in developing countries are exposed to aflatoxin. The Gates Foundation's 2-year study aims to identify high-risk areas as well as methods to control the spread of the deadly fungus. The International Food Policy Research Institute is leading the study, working with African and international agricultural organizations. Dr. Claire Nayrod, a senior researcher at the Institute, explains.
Though we have these different methods to control for aflatoxins and they're in the experimental stage, we don't really know which ones are cost effective. We don't know the economic implications of them and such, particularly on health. So what they've decided to do is to fund this project, and it's $2.69 million, to try to estimate the economic impact on health and on livelihoods so that we can find motivated reasons to get government interested.
Dr. Nayrod says because aflatoxin can originate in the soil, there is a risk of crops being contaminated during the growing season. Aflatoxin also infests crops as they are harvested and later stored. In developing countries, a lack of advanced detection techniques make it difficult to test for aflatoxins. Again, Dr. Nayrod.
Usually in Africa, the way it's done is done visually, and you have a visual separation of infected grains versus non-infected ones. The problem with that, though, is those are the ones that don't go to market. They usually are self-consumed or put into beer or such like that, so you actually end up with this chronic exposure.
It is that chronic exposure that Dr. Nayrod says results in health problems such as cancer, suppressed immune systems, and stunted growth in children. Dr. Nayrod says once the study is completed and the findings evaluated, the Gates Foundation will then take on a large-scale intervention to control aflatoxin contamination. Kimberly Russell, VOA News.
Well, for more information on these stories, go to voanews.com.
And of course, before we let you go, thank you, Linord.
Sure.
Always very informative story selections. And please be sure to watch for Linord Moudou right here on In Focus every Tuesday and Thursday. She always has the latest health news.